Hello everyone, I am Vidya Venugopal, a professor of occupational and environmental health from Sri Ramchandra Institute of Higher Education Research in Chennai. Today, I want to talk about the pressing issue that's becoming increasingly urgent, the intersection of climate change, workplace environments, and mental health. This year's World Mental Health Day theme is "It's time to prioritize mental health in workplaces." We usually picture offices with air conditionings, desks, clear designs as workspaces. That's all good, but what about the millions of workers without them? What about the unorganized workers in construction, in brick, in agriculture? They work out in the open air and poorly ventilated spaces too, and face severe challenges because of climate induced heat. It's widely accepted that climate change is inducing extreme weather events and rising temperatures globally. Our research evidence shows that extreme temperatures can cause a range of heat related illnesses such as heat exhaustion, heat cramps. Prolonged exposures to heat could also cause debilitating diseases such as renal health issues. But physical health is only a part of this picture. What is usually frequently neglected is how excessive heat can affect the mental health of the workers. Extreme heat just doesn't wear down the body, it also takes a toll on the mind of the worker. The anxiety and stress experienced these workers is alarming. Many return home fatigued from physical and emotional stress. Mental exhaustion develops over time, leaving individuals anxious and exhausted. Temperatures aggravate tempers as well, so small conflicts escalate into battles, upsetting workplace peace. Our study has found strong links between workplace heat exposure and psychological difficulties in workers. 74% of them had reported that they are stressed and anxious about the climate induced heat that affects them. Another issue that's hardly considered is a cognitive decline. If you have to put it in simple terms, the way we process our things, it starts to decline. Studies have found links between heat waves and lower mental health scores. Workers struggle with their concentration, memory, and decision making, which are very crucial for their safety and productivity at work. Many workers cannot sleep at home owing to the heat exposures they've had at work and at home as well. In our field of research, numerous participants whom we have worked directly in sunlight experience all the mental health issues that I just explained. Their supervisors knew about these issues, but they had their work targets to fulfill and also productivity goals to achieve, so they couldn't do anything about it. Workers wouldn't quit due to the financial constraints. The need to reconcile their health and their family obligations worsened their mental health. Lack of choice increased their psychological discomfort, making them vulnerable to long-term mental health issues. And there is also this issue of eco-anxiety, the chronic fear of environmental change, which is another emerging issue among populations. Imagine a farmer whose crops fail every year due to rising temperatures, or a construction worker whose safety is endangered by heat, and probably he will not be able to work more hours because of the heat. Job insecurity haunts these people. This fear can cause long-term psychological stress, unhappiness, anxiety, which also results in hopelessness, feeling very helpless, and mental illnesses. If we do not address this now, we risk a mental health crisis on top of the environmental crisis. It is now critical to prioritize mental health at workplaces. Many workers in the unorganized sectors are already experiencing burnout and mental strain, yet they often lack the basic access to mental health services. Workplace environments must evolve to promote not only physical safety but also mental resilience. This is particularly important in unorganized workspaces where the risks of heat-induced mental health issues are very high. There is a problem. Can something be done about it? Of course, yes. Addressing mental health issues in unorganized workplaces is complex, but it's necessary and it's doable at different levels. It can be done at an individual level, it can be done at an organization level, and it can be done at a policy level as well. Remember, action is urgent and evidence is very clear. The well-being of our populations today is the foundation of health of our nations tomorrow.